Hello everyone, I hope all of you have done well in your NEET PG 2023 examination. Now that the exam is over, I know you are in a dilemma whether to check the answers or no. If the answer goes right, well, it's happy for you. If the answer goes wrong, you need not worry, you will never forget this answer and you're not going to repeat the same mistake again. So there's always a scope for betterment. So attend more sessions, make more questions and learn from the mistakes. So talking about the surgery paper, it is easy to moderate kind of paper. There were many repeated questions from the previous years, from the sessions we have discussed earlier. And now let's proceed with the surgery recall session from the NEET PG 2023 paper. So yeah, let's go with the first question. True about the following picture. He gave a not the exact picture maybe, but a similar picture of this. It is what? It is a Fournier's gangrene. This we have already discussed in our last session. The same question has been repeated. So what is he asking? True statement about the following picture. This is what? This is a Fournier's gangrene. Fournier's gangrene. So what is this? This is a polymicrobial infection. As we have already discussed, this is a polymicrobial infection. So mixed infection, this is the correct option. Bilateral orchidectomy, as we have discussed, is not necessary because the testicles are sterile. Like they're safe. They're not infected. So bladder diversion is usually not required. As they have already given in the picture, catheterization is enough. And this is caused by what? Both aerobic and anaerobic, not only aerobic. So the correct option is option A. Next question. A patient who underwent RTA brought to ER, eye opening present on painful stimuli, hand withdrawal to stimuli present using inappropriate words. So what is he asking? He's asking about the GCS score. Every year one question is definitely coming from the GCS part. So GCS is a 5-star topic. So let's see, what are the components of GCS? Eye opening, verbal and motor, E, V and M. And this, so minimal scoring is what? There's no zero in any component. So the minimum score is 3 and the maximum is 15. So how do you do this? Like eye opening. Eye opening present on painful stimuli. What are the eye opening? How do you classify? Like how do you score? Spontaneous on talking, like verbal response. While you are asking the question, asking the questions and all, then only he is opening his eyes. So to speech or to painful stimuli, no response. Spontaneous, to speech, to pain, and then no response. These are the 4, E4. Next, in this what is given? Eye opening is present on painful stimuli. Painful stimuli comes under what? E2. So you can eliminate this option, you can eliminate this option. So we are left with these two. In this also V3 is given same. So you need not check V3. But just for our discussion, we'll see using what? Inappropriate words. Verbal response, how do you see? Orientation to time, place, person, confusion, inappropriateness, incomprehensible. So orientation is given as V5, then confusion, then inappropriate words, and then incomprehensible words. If there is no response, you give it as 1. So is given as inappropriate words. So this comes under what? V3. So E2, V3 and motor. What is the motor component? Hand withdrawal to stimuli is present. Withdrawal. This we have already seen. How do you remember the mnemonic? 1, 2, 3, 4. So withdrawal. W is a 4, like you're writing with 4 lines, no? So remember, withdrawal to stimuli is what? M4. So let's see this. Obeying commands moves to localized pain. Flexion to withdrawal from pain is what? 4. So M is 4. Flexion extension 3, 2. Abnormal flexion, abnormal extension 3, 2. 1 is what? No response. For everything 1 is no response. So E2, V3 and M4. So this is our answer. Okay, so the next question. Clonorchis sinensis is a risk factor for which of the following? So you might be having confusion between bladder carcinoma and cholangiocarcinoma. This is also a direct question. But then bladder carcinoma, what is the risk factor associated with bladder carcinoma? That is our schistosoma hematobium. Schistosoma hematobium is associated with bladder carcinoma, whereas cholangiocarcinoma, Clonorchis sinensis is the risk factor. So our answer is cholangiocarcinoma. So let's see the next question. Okay, this is the life cycle of the Clonorchis sinensis. When an infected person passes the embryonated eggs and feces, these are ingested by what? By snails. These snails, in the snails, they undergo the cycle and free Cercaria larvae are raised into the fresh water. In this fresh water, those larvae lie on the skin of the fish or the flesh of the fish. And when this fish is ingested by man, they go into the duodenum, and in the duodenum, the cyst is digested, the cyst wall is removed, and then existing occurs, and then they go to the biliary ducts where they become the adults, and this is the risk factor for our cholangiocarcinoma. Okay, let's see the next question. Good prognostic factor for BIRADS 5 breast carcinoma. What is BIRADS 5? BIRADS 5 is nothing but, okay, let's see the BIRADS scoring. So BIRADS starts from 0, 1, 2, 3, 4, 5 and 6. 0 is what? You require additional imaging. The imaging you have done is not sufficient, so you require additional imaging. 1 is negative. 2 is what? 2 is benign. The condition is benign. 3 is little more suspicion, probably benign. And 4 is suspicious of malignancy. 5 is what? Highly suspicious or confirmed. But if it is confirmed through a biopsy confirmation, then it is a BIRADS 6. 5 is malignant or highly suspicious. So BIRADS 5 is what? It is a breast carcinoma, malignant breast carcinoma. So good prognostic factor is what? ER positive. If it is having estrogen receptor positivity, so the drugs can directly act on the estrogen receptor. So these three are what? P53, BRCA gene and Ki67. These are indicative of bad prognosis of the breast carcinoma. If it is ER positive, it is a good prognostic factor. Okay, so next question is components of Q-SOFA score. I already told you these named scoring systems, always they'll ask one question from the named scoring system, so you always have to have them in your mind. So what is this Q-SOFA? As we remember it through our mnemonics, Q, you turn it like G. So what is this? First one is GCS, our GCS, like this, GCS. And S is for what? Systolic blood pressure, systolic BP. And what is our third component? You turn this O like R. So we have our respiratory rate. So what are the three components of G-SOFA, Q-SOFA scoring? You write this Q as G and remember it as GCS, and S for systolic blood pressure, and you do this O as R and you remember it as respiratory rate. So these are the three components of the Q-SOFA scoring system. So what is our answer? You need to have GCS, so you can eliminate these two options. Our second one is S, systolic blood pressure. We have systolic blood pressure in these two options as well. But what is the third component? This is what? Our R, respiratory rate. So this is our answer. Blood pressure, respiratory rate and GCS. So what is this G-SOFA useful for? For outcome in the organ failure, severity of organ failure. Okay. So let's see the next question. A person is operated for inguinal hernia laparoscopically. This is important. You need to know if it is laparoscopic or a open surgery. So what is he having? Complaints of post-op loss of sensation on the lateral side of leg. So this might not be the exact question. As per my inputs, what I have received, I've kept this question like this. Some have said that it is given as post-op pain, like that. So lateral side of the leg is receiving sensations from which nerve? From our lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. This supplies on the area, like if you put your hand in your pant pockets, no, what area it covers, that all area is generally supplied by this lateral cutaneous nerve of thigh. So loss of sensation indicates that that nerve is involved, like that nerve is injured in the surgery. So what is the most commonly involved nerve in this condition? So as it is clear that our answer is lateral cutaneous nerve of thigh. And in open surgery, if he has given that it is not laparoscopic and an open surgery, in open hernioplasties, most commonly involved nerve is ilioinguinal in open. In laparoscopic, lateral cutaneous nerve of thigh is most commonly injured. So this is our answer. 7th question. An adult male presented with a midline neck swelling. Some of you have told it that they have given the picture of the neck swelling. So midline neck swelling, this also we have already discussed. Moving with deglutition. So moving with deglutition, we come to a diagnosis of either thyroid or a TG cyst, which is a thyroglossal cyst. And they gave us adult male. So branchial cyst might not be our answer because it is present from the birth. So you can eliminate this. Thyroglossal cyst, yes, this might be our answer. Dermoid cyst is generally also a midline swelling, but it doesn't move with deglutition, so you can eliminate this as well. And ranula is what? On the posterior aspect of tongue, on one side we have this light bluish translucent swelling, that is ranula. So this is also not related to deglutition. So our answer is thyroglossal cyst. Next question. A man working with heavy machinery came with complaints of his fingers turning white. Fingers turning white intermittently while working. So this is also important. So they're turning white and they're after some time they're becoming normal. So what is it likely due to? So what is this? Fingers turning white intermittently and on its own they're recovering. This is nothing but your secondary Raynaud's phenomenon. Secondary Raynaud's phenomenon. So what is the secondary Raynaud's? You have your normal hand. When there is cutoff of the blood supply, first the fingers turn to whitish color, and then so complete lack the oxygen present there is also utilized, and then the complete lack of oxygen. So you have this cyanosis, which is blue color. So normal color followed by white, followed by blue cyanotic, and then after some time the blood flow returns, so it becomes to reddish color. So this is the secondary Raynaud's phenomenon. Okay, so what is the next question? History of trauma 5 years ago. Trauma history. And what is the area given? Chest. What is the probable diagnosis? Some of you have told that they have given this kind of picture, similar picture. So what is this? Trauma is present, so there will be some scar, and over that scar these are what? Keloid. This is nothing but a keloid. And if in case of neurofibromatosis, you can have this cafe au lait spots. Cafe au lait spots will be present. And hemangiomas are just vascular formation. So this is also not our answer. Thrombophlebitis doesn't present like this. So, and moreover, he given it as chest area, which is giving the sternum. Sternum is most common site for what? Keloid. Keloid most commonly occurs on sternal region. So this is probably a keloid. Next question. An old male who's a chronic smoker came out with complaints of what? Complaints of weight loss. As we already thought, weight loss might be indicating towards either tuberculosis or malignancy, most probably, depending on the rest of the situation. And chronic cough. His serum calcium levels are low. Hypocalcemia. He's having hypocalcemia, weight loss, and atypical cells seen on biopsy. Atypical cells on biopsy. What type of lung carcinoma can be seen in this patient. Okay, he gave the diagnosis as lung carcinoma. He's asking just the histological type. So, and what is our main hint in this question is a smoker. So, as I have already discussed, lung carcinomas are central and peripheral. And these central are what? Squamous and small cell carcinoma are centrally located. These are centrally located, like within involves the central area of the lungs, which are nothing but the bronchogenic tree and all. Peripherally located tumors are our adenocarcinoma and large cell. I think these are only the options. Some of you have given me different options, but anyways. So you remember our hint as SSS, triple S. So what is this triple S? Squamous and small cell carcinoma are associated with smoking. So smoking is a risk factor for which of the conditions? Squamous type and small cell type. So these two are associated with smoking. So you can eliminate the other two options, lung cell and large cell carcinoma. Adenocarcinoma and large cell lung carcinoma. So out of these two, squamous is mostly associated with, most common type associated with smokers is squamous. So probably you might go with this answer. This is also actually correct only, but hypocalcemia is also associated with both squamous and small cell also. So there might be some other clue in the question. I haven't received the complete question. So depending on the question or any other, if they have given any other hint, you might go through it or let me know so that I'll change the answer. But as of now, smoking most commonly associated with squamous, which is followed by small cell carcinoma. So squamous, small cell, smoking. Remember it as how? Triple S. In that also squamous is most common. Okay. The next question. A male chronic smoker with ptosis and anhidrosis. I'm not sure if anhidrosis is given in this question or no. And history of loss of weight. And chest x-ray is also given. Similar chest x-ray was given showing what? A mass in the apical lobe. Apical lobe of the lung showing mass. Whenever you are talking about the apex, what is the most common thing that comes to your mind? It is nothing but our Pancoast tumor. As it is like loss of weight is present, malignancy, so it is also pointing out towards your Pancoast tumor. And he's just if it is an aspergilloma, he might be having complaints of cough, and then he might be having complaints of fever episodes or allergic episodes and all. So this is not an answer. Pancoast tumor, yes. Pulmonary thromboembolism, how does they present? Sudden dyspnea. They'll have sudden dyspnea and all. So this is not our answer. SVC thrombosis. Superior vena cava thrombosis, how does they present? When there is obstruction in the superior vena cava, you have this raised JVP and all those. So this is also not our option. So most probably it's pointing towards Pancoast tumor, which is a tumor of the apex of the lung. So next one. A patient who is a known chronic pancreatitis underwent radiological investigations which showed calculus. Chronic pancreatitis, calculus in the main duct and dilated duct. So he has given the duct is dilated. So what is the treatment of choice? Pancreoduodenostomy, you won't do that because when you commonly do it when there is mass in the head or something like that. So what is done in this condition? Pancreaticojejunostomy, which is nothing but the dilated duct is opened up and you take a jejunal loop and anastomose it with the duct. So pancreojejunostomy is the treatment of choice, which is also called as what? Ptosis procedure. Ptosis procedure. Here is a picture of that. The dilated duct is opened up and a jejunal loop is connected so that all the secretions will drain directly into the jejunum. Treatment of choice is an old male patient with mass over the glans penis. Where is the tumor present? It is present involving only the glans. So you won't do an orchidectomy. And the answer is partial penectomy. It is involving only the glans, which is nothing but the distal part of the penis. So you'll go for a partial penectomy. If at all you have to go for chemotherapy, what cisplatin and bleomycin are used. So they are not present in the options. and involving only glands, so partial penectomy is enough. If it is involving whole of the shaft, then you can go for a total penectomy. So our answer is partial penectomy. Next, this is a simple direct anatomical question. That deep ring is a defect in which layer? So these are the layers. Some of you have told me that they have given this picture and there's an arrow pointing out towards this and the question was asked. Or you can just know this is the superficial ring and this is your deep ring. So superficial ring is what? A defect in what? This is your external oblique. This is your internal oblique. This external oblique and its aponeurosis. A defect in the external oblique aponeurosis is your superficial ring. And a defect in what? External oblique, internal oblique, and this is your fascia transversalis. So defect in fascia transversalis is nothing but your deep ring. So the answer is, he's asking about deep ring. So this is fascia transversalis. If it is an external oblique, it is your superficial ring. Next, a 30-year-old female with complaints of abdominal pain, weight loss, sterile pyuria, radiograph is given. This is what? This is your classical image of your putty kidney. So this is also a direct question and as this has been repeated many times. So he has just asked the diagnosis. This is nothing but your putty kidney. What is this putty kidney? This is all the caseating necrosis. Caseating necrosis in your genitourinary TB of the genitourinary tract. So next question. Alcoholic patient with symptoms of diarrhea and pain in the right hypochondrium. Symptoms of diarrhea, pain in right hypochondrium and liver abscess. He has given liver abscess. In liver abscess, you have to see if it is a pyogenic liver abscess or an amoebic liver abscess. So he has given diarrhea. So mostly it is pointing us towards your amoebic liver abscess. So what do you do in an amoebic liver abscess? In amoebic liver abscess, you go for medical management, which is nothing but metronidazole 750 mg. You give it for 2 weeks. This is the mainstay of the treatment for your amoebic liver abscess. If it is pyogenic, then you do a percutaneous drainage. Percutaneous drainage is done in pyogenic liver abscess, but he has given it as diarrhea and all. Most probably he might be giving other hints as well. I'm not sure of the question exactly, so leaving it to you. So the next question is CEAP classification. This also we have discussed in our last session and I told you there will be one question coming from this topic definitely. So what did he ask? Classification for varicose veins with eczema. As we have remembered, E for reverse 3, that is edema, and 4 is what? C4 is your skin changes. Skin changes comes under 4. So 4A and 4B. 4A is after this edema another E, that is eczema. Eczema or pigmentation comes under 4A and 4B is your lipodermatosclerosis, thickening of the skin. So don't confuse it with this E. 3E is for edema. Edema is your 3E. 4A, 4B are your skin changes. 4A is eczema. So this is our answer. 5 and 6 are what? 5 and 6 are for ulcer. Healed is 5. Active is 6. So next question. 4-month-old child with jaundice and pale stools, dilatation of the duct and biliary plugs were present. ALP is increased. Liver enzymes normal. Okay. Biopsy shows what? Proliferation and fibrosis of the ducts. What are these all pointing to? Like the biliary ducts are obstructed, atresia of the ducts is present, and due to this pooling up of secretions, they are dilated and biliary plugs are formed. So this is nothing but your biliary atresia. What is the procedure done for this? Named procedure, that is Kasai's procedure. For extrahepatic biliary atresia, you go for a Kasai's procedure. This is also named, so this might be given in next time. And these two are anyways your enzyme deficiencies, and this is not the classic condition for HCC. So you'll go with biliary atresia. Okay, next question. A medical student presented with exophthalmos signs of exophthalmos, palpitations and heat intolerance. What are all of this pointing towards? Hyperthyroidism. And commonly antibodies like autoimmune hyperthyroidism, you'll always generally look it as Graves. So in Graves, what are the antibodies? So in Graves, the antibodies are nothing but long-acting thyroid stimulating antibodies, your LADs. What are these? These are antibodies against your TSH receptors. Against your TSH receptors. So anti-TSH receptor antibodies. And anti-TPO is what? This is your Hashimoto's. So next question, complications most likely to occur in the following condition. What is this? This is your congenital melanocytic nevus. I'm not sure if the exact picture is given or some other picture, but a similar picture. So nevus is what? Melanocytic nevus is a premalignant condition for malignant melanoma. So this is your answer. I don't know if the other option is given as what. Next question, patient with complaints of fever, chills, right upper quadrant pain. This is similar to your liver abscess question, but the X-ray is given. What is this? This is classic of your water lily sign. Water lily sign or what? Camelot sign. So this is seen in your hydatid cyst. And what do you do for this? He's asking about true statement. I'm not sure if he's asking true or false. The options I have received is like caused by echinococcus. This is one option, that is pakka. So this is a true statement. Echinococcus granulosus is the most common causative organism. So you'll definitely go with it, no doubt. Surgery is not mandatory, but generally what is done is puncture, aspiration, instillation of the what? Colicidal agents like hypotonic saline and all you'll instill and re-aspirate it. Aspiration is generally not done because there is a risk of anaphylaxis. If there is spillage of that hydrated sand and all, anaphylaxis is a risk. So this is quite like little complicated, but this is a Pakka true statement. So you'll go for a caused by echinococcus granulosus. I'm not sure if these options are correct or there are any changes in these options. Just check on with it. You need to let me know what this is. 22. What is the next question? A 5-year-old child with bleeding per rectum. Complaints of bleeding per rectum and rectal polyp is present. Dilated mucin-filled glands are seen on biopsy. Okay, this is classic. What is the probable diagnosis? So what is the type of polyp he's asking? So you can eliminate these two options. Anyways, it's not a choriostoma and not an adenocarcinoma. So what are the type of rectal polyp that is common in children? It is nothing but your hematomatous polyp. Hematomatous polyp is common in children and adenomatous polyps are usually seen in adults. And this hematomatous polyps are a benign condition. Risk of malignancy is very less in them. And adenomatous polyps has a risk for malignancy. So these two you need to differentiate. So you'll go with adenomatous, like hematomatous polyp because he has given it as 5-year-old child and just mucin-filled glands are present. No malignant changes also. What is the next question? Abdominal gangrene with dyspnea is present. Incorrect statement. Some of you have told that they have given a picture of the abdominal gangrene. So I'm not sure. Anyways, the question is similar to this. So abdominal gangrene with dyspnea. What is this abdominal gangrene? Some of you have also told that there's a surgical history given. Is it true? I'm not sure. So this is nothing but a question was about Melanese gangrene. That is, I'm sure. Because this Melanese gangrene is nothing but what? There'll be a surgical history and at that surgical site, due to the synergistic infections, gangrene of the necrotizing fasciitis of the superficial fascia and skin layers occurs. This is called as Melanese gangrene. And hypobaric oxygen is used in these conditions. This hypobaric oxygen, like just it helps with like it neutralizes the anaerobic organisms. If the anaerobic organisms are present, it will neutralize it, and it also helps for proliferation of the fibroblasts and all. So this is, no evidence is present, but then radically they say hyperbaric oxygen is used, and debridement is done every 24 hours, not exactly for 24 hours, but then daily debridement is done because it is involving only your superficial layers and skin, no? So debridement is done. So partially this is also a correct option. And streptococci is the main causative organism. For this melanic gangrene, Staph aureus and strep are the main causative organisms. So this is also a true statement. If he's asking about the incorrect statement, you have to go with this is hyperbaric oxygen is not used because it has a saying that it is used, but there's no evidence. What is the next question? A patient with cirrhosis presents with bleeding and hematemesis. So cirrhosis presenting with bleeding and hematemesis, this is generally what? Pointing out towards your portal hypertension. So what did he ask? Anastomotic site of bleed. So where is this bleeding coming from? Hematemesis is usually what? I've not received what are the exact C and D options, but then I'm sure that it is a portal hypertension question, and he's asking about the anastomotic site. So you have your celiac trunk coming from the aorta, and the celiac trunk giving you left gastric artery, left gastric vein. Left gastric artery comes like and supplies this along the lesser curvature of the stomach, and you have your azygous vein, and from the azygous vein esophageal vein coming, and these both forming the anastomosis. So hematemesis, here this anastomotic leak leads to hematemesis. So what are the involving vessels? Left gastric and your azygous, esophageal branches of your azygous. So your answer is this. Superior rectal and sigmoid, what? This leads to your hemorrhoids, not hematemesis. Bleeding per rectum and hemorrhoids, this points towards superior rectal and sigmoid. And if they have given it as a caput medusae variceal distension around the umbilicus, then it is your around the umbilicus. So this is not the option. I don't know other two options if they have given it as other anastomotic sites or other options. So our answer is left gastric and azygous because they have given it as hematemesis. Next question. A patient ingested NaOH. What is NaOH? This is an alkali and now presented with complete dysphagia. So this is nothing but a late presentation of the alkali ingestion. So what did he ask? Next step of treatment. He's asking the treatment. First tell me what is more dangerous, alkali ingestion or acid ingestion? Alkali. Alkali is more dangerous than an acidic because this causes what? This causes your liquefactive necrosis of the tissue. Liquefactive necrosis. So, and he's presenting with dysphagia. So you can't like put a scope or something and see because there is a risk for what? Rupture. There is a risk for perforation. So you won't do any endoscopy or something. What do? You pass a small tube, a rice tube kind of thing, small feeding jejunostomy. Feeding tube is passed and do a feeding jejunostomy. These surgical procedures are not required generally. Stenting is also not done. So you pass a feeding jejunostomy and you give this parenteral, like there is no direct entry, no? You give this kind of feed. Okay. Next, a mobile swelling present on the cheek near the angle of the jaw. I'm not sure about this question. I haven't received the complete question, or just I've received the saying that there is a swelling given at the angle of jaw like this. Most probably it points out towards a parotid tumor. It will be easy if he has given that lifting of the ear lobule and all. If he has given more of those kind of points, you'll go with a parotid tumor. Anyway, sebaceous cyst is not your answer because he'll give a punctum. There is no punctum, so sebaceous cyst is not your answer. You can eliminate this. And dermoids are generally seen in a midline, fusion of two bony prominences. So most probably it's pointing out towards your parotid tumor. And what is the next question? Ulcer on foot with callosity. Ulcer is present, callosity is present, and the patient is diabetic. So you'll go for what? Trophic ulcer. Because venous ulcer, he'll give history of varicose veins or something. Arterial ulcer, any peripheral vascular disease, smoking history, or gangrenous tissue, all those will be given. And it is definitely not a malignant ulcer. So callus is present in what? In diabetic ulcers, the surrounding tissue becomes fibrous and hard, and it gets like callosity is formed. So this is your trophic ulcer. Due to chronic pressure and neuropathy there, the skin gets fibrous and trophic ulcer is formed. 55-year-old alcoholic with elevated bilirubin. Bilirubin increased and liver enzymes normal. Okay. History of weight loss, so pointing up towards malignancy. Elevated AFP pointing up towards malignancy. AFP and GGT generally point out towards what? Your HCC. And weight loss is present. Alcohol is risk factor for commonly for what? For cirrhosis, and cirrhosis is risk factor for what? HCC. So the probable diagnosis, I would go with the HCC. So this is the last question. If you're having any doubts, you can like comment on the video. I'll answer your questions and doubts. Everything I'll answer. And you can just recheck with the questions. If you have any like you want to suggest some options or any changes in the questions, you can go through that also. Just let me know in the comment section below. Okay, I hope most of you have given all of the questions correct. Even if you haven't given it good this time, you always have another chance. Okay, try it for the next time. Do well, attend more sessions and do this well. Okay, thank you.